are you?
I'm good. How are you?
I'm all right. My name is Melissa. I'm going to be your nurse for today.
Okay.
And today we'll be performing a physical assessment on you, okay?
Okay.
I'm just going to wash my hands. And can you tell me your name and date of birth?
My name is Michelle, and my date of birth is 11/9/76.
And do you know where you are?
I'm in the hospital.
Okay, and what year is it?
It is 2013.
And who's the president?
Barack Obama.
Okay, and how are you feeling today?
I'm doing good.
Do you having any pain?
No,
No pain at all?
none.
Awesome. All right. So the patient appears her stated age, and she's A0 times 3. Her hygiene appears appropriate. She has appropriate facial expressions. Her vital signs have been obtained, and her height and weight has been obtained. Okay, so I'm going to start with your head and move all the way down to your feet, okay?
Okay.
I'm going to inspect your eyes. Oh, are you allergic to anything?
No.
Okay, and her nutritional status appears appropriate. She appears well nourished, and her posture is appropriate. Okay, I'm going to inspect her head for symmetry. I'm going to inspect and palpate her scalp for any lesions or bruises or bumps. I'm going to palpate the maxillary and frontal sinuses. And the temporal artery. And the temporal mandibular joint. Can you open and close your mouth? Okay. And can you frown and smile and puff your cheeks out and raise your eyebrows? Thank you. And close your eyes tightly. All right. Okay, I'm going to assess her visual acuity. And we did a Snellen eye chart on her earlier, and also assessed her gait and posture as she walked to the eye chart. Okay, I'm going to assess your acuity. If you can just keep your eye on my otoscope. And I'm going to assess her convergence. If you can cover one eye, and tell me when you see the object.
I can see it.
Okay. Switch eyes.
Coming from the side.
Then tell me when you can see the
Now.
object. Let's do that other eye one more time.
Now.
Awesome. I'm going to assess her sclera and conjunctiva. And I'm going to test her pupils and make sure that they're reactive to the light, which they are. I'm going to inspect her nose. Everything looks good. And I'm going to do a sniff test. Can you tell me what you smell?
Lemon.
Very good. I'm going to assess her ears. Check for symmetry. Any pain or tenderness?
No.
Okay. And I'm going to assess the inner ear. Okay. I'm going to assess her mouth. Her lips look moist. Open it. Can you stick your tongue out? And can you say ah? Uvula is intact and midline, soft, hard palate, tonsils. Everything looks good. Okay, we're going to do a whisper test to assess your hearing. I'm going to whisper a word in your ear. You can just tell me what I said.
Christmas. Easter.
Very good. And you stuck your tongue out. Her gums look good. Heart and soft palate look good. Okay, moving on to the neck.
I don't think
No.
it's cardinal gaze.
Oh, okay, and we're gonna continue the eye assessment and do the 6 cardinal gaze. If you can follow this with your eyes only. Great. Okay, now we'll move on to the neck. Just do an inspection. It's symmetrical. I don't feel any lumps. If you can take your head back, forward, side to side. Very good. I'm going to assess her strength. If you can press and press. Okay. Now we'll move on to the neck, and I'm going to assess her thyroid. And if you can swallow. Very good, very good. I'm going to auscultate her carotids one at a time, or I'm going to palpate them one at a time. And auscultate her buoy with my stethoscope. I'm going to assess for a jagged vein distension, which I see none. No buoy heard. Her trachea appears midline. And I'm going to assess the lymph nodes in her head and neck. We have preauricular, posterior auricular, occipital, jugulogastric, superficial cervical, posterior cervical, superior clavicular, submandibular, submental, and deep vein cervical chain. Okay, we're going to work on your upper extremities. If you can shrug your shoulders for me. Okay, and if you can shrug them against my resistance. If you can take your arm around and your other arm around and both your shoulders around. Very good. Okay, I want you to squeeze my hands. I'm going to test your grip strength. Good. And if you can press against my resistance. Ooh, nice and strong. Okay, I'm going to assess your nail beds. Her capillary refill is less than 3 seconds. Her nail beds are pink and moist. Her skin is dry. No bruises or bumps or lesions seen. I'm going to assess your pulses. And your radial pulses. And your skin turgor. Okay, we're going to move on to your chest and lungs. Her AP diameter appears to be 2 to 1. Transverse diameter 2 to 1. I'm going to inspect her posterior thorax. If you can say 99.
99.
Say it again, please.
99.
Say it again, please.
99.
One more time.
99.
And we're going to do the other side.
99.
One more time.
99.
One more time.
99.
And one more time.
99.
I'm going to check her chest expansion. If you can take a deep breath. Okay, very good. I'm going to auscultate the lungs while I'm back here. Okay, you can take a deep breath. And another one. Okay. the lungs. Okay. Now we're gonna go to the anterior thorax. Assess symmetry. Trachea appears to be midline. And I'm gonna auscultate. Take deep breath. And I'm gonna percuss the anterior thorax. Okay. Okay, we're gonna move on to the heart. I'm gonna just inspect the pericardial area. And I'm gonna auscultate. The aortic, pulmonic, herbs, tricuspid, and mitral. And if you can lean forward, and I would assess the mitral valve. Okay, we'll move on to the abdomen. For this portion, I'll have you lay down on the table. That way. Fall asleep. Okay. So for the abdominal assessment, first I'm gonna just inspect. I don't see any pulsations. The skin looks good, warm and dry. There's nothing abnormal noted. Next, I'm gonna auscultate. I'll be listening for any abnormal sounds. I'll be checking to make sure her bowel sounds are present. Okay, bowel sounds present in all 4 quadrants. I'll assess for any vascular sounds with the bell of the stethoscope. And I'm gonna percuss the abdomen and evaluate the lower liver border. Sorry, cold hands. And I'll percuss. Any pain or tenderness?
No.
Great. We'll have the liver over here, the spleen, the stomach. Okay, and I'll move on to femoral and inguinal pulses. I will assess them the inguinal up here, and popliteal. Popliteal process. And now I'm gonna inspect her lower extremities. The skin looks warm and dry. No lesions or bruises noted. I'm gonna check her range of motion. I'll assess her tibial process. And her pedal process. Assess for any pre-tibial edema, which I see no edema, noted. And if you can, I'm gonna assess her muscle strength if you can press. And her muscle strength is appropriate. Okay. I'm gonna have you sit up on the side of the table again. You didn't fall asleep, did you?
Wanted to.
Okay, so now I'm gonna assess your coordination. If you can touch the tip of your nose with your hands like this on both sides, great job. And if you can touch each finger with your thumb. Okay, I'm gonna test your pronation and supination. You can go up and down. Yep, great. Great job. Okay, and I'm gonna test your reflexes. So we'll do your bicep with the edge of my stethoscope. And your tricep. There's your reflex. And your brachial radius. I don't know, hold your thumb. And right there. Great. Okay. And I'm gonna inspect and palpate your spine if you can stand up.
You want to do this process?
Oh, you know what? Yep.
That was your phone a friend.
We'll do. That was my phone a friend for the record. I'll do your patellar reflex. Right here, phone a friend, right here. You're Achilles. Okay. Hey, you're Achilles. Okay, now I'm going to inspect and palpate your spine and assess the range of motion. If you can reach down. Spine feels straight and aligned. Okay, you can stand up. And a Romberg's test, if you can close your eyes. No, she's not falling, she's not waving or anything like that. You can have a seat. Okay, thank you. You look great. If you can put your clothes on and have a nice day, okay?
Okay, thank you.
You're welcome.